Hello everyone and welcome to the sixth and final video in our series on pediatric growth, development, and assessment. In this video, we'll talk about the adolescent. The definition or age range for adolescence varies depending on the reference or text that you are using. The generally accepted definition is ages 13 to either 18, 21, or 25 years. Health promotion in adolescence can sometimes be a challenge. This is probably the second most active period for rapid physical, cognitive, social, and emotional maturation. They're really starting to transition between childhood and adulthood, and consequently, they want to be treated as such. They're looking for their own power and authority to make their own decisions. Some important terms to be aware of for this discussion include prepubescence, which is the 2 years before the onset of puberty, puberty, which we know is the development of secondary sex characteristics, and postpubescence, which is the 1 or 2 years afterwards. The body undergoes many important changes during adolescence. External and internal organs necessary for reproduction start to form and finish, as well as, because of hormonal changes, we see vocal change, hair growth, breast enlargement, and fat deposits. Some neuroendocrine events of puberty include the increased secretion of estrogen and androgens. These are responsible for the sexual maturation in girls and boys, and we assess these maturations using the Tanner stages. Feel free to pause the video as you review the Tanner stages. These are the Tanner stages for breast development. These are the Tanner stages for genitalia development in women. And these are the Tanner stages for genitalia development in men. As we said earlier, there's rapid physical growth in adolescence, specifically during puberty. We tend to see growth spurts, and the growth patterns are different for men versus females. Also, we see important other changes as well, such as heart rate, blood pressure, a decreased overall blood volume, and slower respirations. For cognitive development, the adolescent really starts to show evidence of being able to perform formal operations. They can think into the future and they can anticipate consequences. They're also very concerned about others' thoughts, perceptions, and needs. Adolescence is also a crucial period for developing morals. Children start to question their existing moral set of values and how relevant it is to society. Erikson's task for psychosocial development in adolescence is developing a sense of identity. Children develop their own individual identities, but also develop a group identity. The social environment of the adolescents is crucial to their optimal development of biologic, cognitive, and social skills. They need to have the opportunity to develop these. We need to help them remove barriers and provide them with role models. This can be present in families, peer groups, schools. Children start to work at these ages, and then also in any sort of hobbies, interests, or activities that they do. Adolescents have different perspectives on health than any of the other age groups we've discussed so far. Adolescents want to be treated like an adult and they want to be involved in their own decision making. We need to ask them about stress, anxiety, relationships with their friends and adults. We also need to bring up anything that's on their minds. As far as sadness, we start to see anxiety and depression being much more prevalent in this age group. They also tend to be more apt to be involved in risky behaviors, such as substance abuse, sexual activity, and recreational and motor vehicles. Promoting optimal health for adolescents includes asking them about their emotional well-being. We want to know about their dietary habits. This is an important question because many adolescents are at risk for childhood obesity or other eating disorders, such as anorexia or bulimia. Physical fitness is important, as well as starting to screen for hypertension and hyperlipidemia. Common concerns for this age group include emotional well-being. We should perform depression screenings and ask them about anxiety. Mood swings are very common due to stress, anxiety, and hormonal influences. We need to teach our adolescents some coping skills to help them get through this period of their lives. Injury is also very important. The leading cause of death, motor vehicle accidents. But also, this is when we start to see more and more intentional injuries. The second leading cause of death is suicide among adolescents. This is why it's so important to ask them about depression and anxiety in any setting we take care of them. In addition, we need to teach them about firearm safety, risk-taking abilities, and the fact that they feel indestructible but really can be hurt. In addition, dietary habits are very important as well. Their metabolism and necessary intake will increase during puberty and growth spurts. In addition, peer acceptance is a heavy influencer of dietary habits. Some general anticipatory guidance again includes sexual behavior, sexually transmitted infections, and pregnancy, but also substance abuse, school and learning problems, depression, body art, and sleep deprivation and insomnia. It's also important to recognize and support our LGBTQ plus adolescents. As we said earlier, adolescents are at risk for eating disorders. Obesity is a pervasive problem in the United States, and nutritional counseling can help. Anorexia and bulimia can also happen. Regardless of what the eating disorder is, the three main goals of treatment are to reinstate normal nutrition, resolve the disturbed pattern, and refer them to individual psychotherapy to prevent any further issues. Anticipatory guidance also includes substance abuse. Drug abuse, misuse, and addiction are more common than you think. These are voluntary behaviors. Typically, this begins with just experimentation. Also, tobacco and smokeless tobacco or vaping are very common among children in this age group. They need to know the risks involved. Depression, suicidal ideations, and attempted or completed suicide are far more prevalent in childhood than anyone is comfortable talking about. We need to make sure that we take our time to screen our adolescents and get them the treatment that they need before something terrible happens. Thank you for watching our video series on growth, development, and assessment in pediatrics. I hope you enjoyed it, and please feel free to send us any feedback that you have.